Hi, I'm Michelle Krause, and I've been seeing a lot of people talking about vagus nerve issues. Or actually not vagus nerve issues, but anxiety and nauseousness and dizziness. And I'm going to try and stay focused because I usually end up going on a tangent and talking about different things. So this time I'm going to try and really stay focused on that vagus nerve. Now, I will tell you that the vagus nerve issues can come from clenching and grinding your teeth. Clenching and grinding your teeth come from misaligned bones and misaligned structures. So if you take a look inside here, the vagus nerve is going to be in this area right along here. This is our sphenoid bone. Our sphenoid bone is a bone that actually moves inside of our skull. That bone helps to push the nervous system, the fluids, down into our body. So you can see where, it's kind of hard to see where the red bone and the orange bone come together there, but then you can see the brown bone. Well, this bone is going to be your brown bone, and this red one is going to be the red one. And so the movement that it makes in the body, and this bone right here, it goes from temple to temple, and your eyes are sitting right in front of it, so it would look like this on me, okay? This right here is a little junction that comes together, and when the fluid goes into the body, this is going to be an exaggeration, it opens up and it fills into the skull. When the fluid goes into the body, this bone pushes, these bones go together, and they push that fluid down to the toes. Okay, now, here is the thing. This bone takes a lot of jolting. So anything that can happen. So say you get hit right here with a bottle, and it jams your maxilla right up into your face. So it can just jam, oh, he's even a little off here. So it can jam your maxilla up into your face. Well, that affects that bone because it touches it. If somebody comes up, hits you in the side of the head with a ball right here, or if your child jumps up, hits you right here, that could jolt that bone and shift it off a little bit. Can shift it up, shift it off, shift it out, compress it. All of those things make a difference in how your body communicates the cranial sacral fluid and the blood flow and the lymphatic, anything going on in the body, because any fluid that changes, another fluid's going to change as well. So that being said, we're only handling this part of it, okay? So if you start, what'll happen is you could start clenching and grinding your teeth, because now if your maxilla is out of alignment, or anything else, then your body is going to try and fix it, because our body is self-healing. Just like when you get a cut on your arm, your body wants to heal it. Your body's trying to figure out. Now, if you had something emotional happen and you've been crying a lot, or your hormones are off and they're causing inflammation up in your skull, that's going to cause a problem too. So now you might have, and almost everybody's going to have a misalignment in their body, because we have not learned how to take care of ourselves. It's not something that we've been taught. There's nothing that you've done wrong. You just don't know. It's starting to come to fruition now that we're starting to see these things, so it's exciting. So that's what I want to do for you. So what happens is that we may start clenching and grinding our teeth. When we do, let me see how well you can see this. There you go, you can see it pretty well. You can see these muscles in here. When we clench and grind our teeth, these muscles in here are going to get tighter and tighter and tighter, because look how close they are. They're actually really, really close. You have a muscle that goes here. You have all these muscles that come up here. You have a muscle that goes around. Tons of different muscles, little muscles we haven't talked about. But those muscles will squish this in. They will pull your C1 out of alignment. Then your C2 will come out of alignment, and then your C3. And then what starts happening is these start to squish down. You start getting limitation in space. You now all of a sudden don't have that space and the balance. So you don't have the left and right the same. You don't have all that space for the fluid to flow through, because things start to get restricted and tight. Now I'm going to share with you a little bit about how that affects down into your digestive system. So your vagus nerve, like we said, starts up in here. Your vagus nerve comes, it is your longest nerve. It's also your most emotional nerve. This nerve can hold stuff. So as it's coming down here, it's hitting the respiratory system, right? It's also hitting the digestive system right in here. It's also hitting our avenue of expression, our hyoid bone, the tension in our jaw. That's one of the ways that can misalign the jaw as well. There are many ways the jaw can be misaligned. Then you come down in here and it's going to hit your heart because the vagus nerve runs all the way down here. And it's going to hit your stomach, and it's going to hit your pancreas, and it's going to hit your liver, and it's going to hit your gallbladder. Your gallbladder is underneath your liver. So think about whenever somebody talks about getting a concussion, did you feel nauseous? Well, when someone gets a concussion, most likely they also have whiplash. What whiplash is right in here. If you get hit by a car, or if you fall down and hit your chin, or I mean, you could fall and hit your bottom and end up with whiplash. What happens is this area right in here is going to end up getting overly tight. On most people by the time they're 30, and I highly believe it's more than that now with cell phones and computers, this area is no longer going to be curved, so your head goes forward, and that's an awful lot of pressure right in there on the vagus nerve. So when you get into an accident, they ask you if you don't, if you felt nauseous. Well, what that is your liver sitting right here and your gallbladder underneath, and your gallbladder shoots out a little bit of chemical, backs up into your system, and it makes you feel nauseous. So it's your gallbladder almost misfiring. But remember, it isn't your gallbladder that's the problem. A lot of times people, the doctors will say it's the gallbladder, because guess what? That's what they're a specialist in. They're not looking at what might have caused this for you. And oftentimes they have people get their gallbladders removed. You still will get that nauseous feeling even if you have your gallbladder removed, because it's the vagus nerve. So the vagus nerve then branches out, and it hits all along the digestive system. It's going to hit the intestines, it's going to hit the stomach, it's going to hit the liver. It's all over in here because it is your longest cranial nerve. And so I want you to take that with you when you're wondering, why am I getting nauseous? Is this menopausal? Is this old age? Again, it is most likely imbalance. It is inflammation that comes with that imbalance. It's inflammation that comes from possibly taking medications. So if you add medications after a while, even ibuprofen that says that it's an anti-inflammatory, it is eventually going to be a toxin in your body that your body is fighting. And when your body is fighting those things, that inflammation has no other place to go but in the tissue. And when that tissue gets tight again, we are talking about that tissue getting tight, the tissue blocking off and leaving less room for the nervous system to communicate, for the blood to flow properly. And the fascia is what some of that tissue is that we're talking about too, which is like a spider web that is wrapped all throughout your body. I did mention that I was going to put the fascia video tagged when I posted a video last week. I'm going to post that fascia video with this. But I just wanted to let you know that these are the things that are going on. It's not just one thing. It's not just I feel nauseous. It's that tension in the base of your skull. It's the clenching or the tightness of your jaw. Could be from having braces when you were younger. Could be from an old injury from sports in school when you got hit on your shoulder and it caused your neck to go to the side. So let's think about all these things. If you would like to reach out to me and get a consult, if you are not in the area, I do have a consult for people that can reach out to me. We can do a telehealth session where I teach you a couple of things you can do to get yourself over the edge, give you some resources, and then also give you some resources to keep. I can also direct you in your area to get to a craniosacral practitioner near you, because what craniosacral therapy does is it takes that fight or flight out of the body. It creates space, it creates balance, it allows that tissue to go back to the relaxation and takes that angst out of it, that fight or flight mode that you get stuck in. So I can send you to somebody near you, or if you're in my area, you can come see me. I'll put my contact information below this, but I really wanted to share this with you because there's so much going on with anxiety and nauseousness, and all of that stuff comes together. Heart palpitations come with that. Digestive issues come with that. Allergies can also come along with this. Now, mind you, those things aren't going to be fixed overnight, because it has taken probably decades for your body to have continuous shifts in it, continuous movements, a bunch of different injuries. So it is going to take a little time, but it's definitely worth it, because if you don't have heart trouble, if you're not having problems with diabetes, all of that, it is not old age, because not every single person has those things. So let's get your body in alignment. Let me be there for you. Let me help you. And I look forward to hearing from you. And you have a great day.